Okay, we're on. Let's call this meeting to order. It's 8:15. Let the minutes show that Doug is excused. Everybody else is here. We need a motion to approve the agenda and the minutes from the November 11th meeting. If we could get that motion, please. Do them both at once.
I'll move.
Moved by Joe, seconded by Scott. Any questions? No questions. All in favor signify by saying aye.
I
Aye. Opposed? Motion carried. Public comment. Anybody for public comment? Hearing no public comment, we'll move on. You are up, Tracy.
Okay, everyone got the printout for our current 2020 budget. Did anyone have any questions on any of it from what they seen? Okay, just so everyone knows, I just received the third quarter reimbursement from Point Beach yesterday. And then according to my eGrant portal where I submit my grant paperwork, the EMPG, the $25,000 one will be reimbursed. I just have not seen the paperwork come through as to them sending that payment. Otherwise, our expenses are right on.
Okay.
Next is reviewing upcoming training and exercises. So currently in September of 2021, we are scheduled to have our next Point Beach evaluated exercise. We are in communication with the state right now to see how that is going to be held. Are we doing some of it virtual? Are we going bare bones on what can and can't be done? Point Beach had hoped to postpone the drill or the exercise, but we have to be careful on how far that gets pushed out because Prairie Island, which is another one that the state participates in, could have them going back to back. So we're just looking at some of that, and that will affect how we do some of our training with the EOC and reception center personnel. Next is update on sirens. I don't have anything further at this point in time.
Tracy.
Yep.
I did have the two sirens in our town on the agenda, and we want nothing to do with them.
That is good to know. I've had some preliminary discussions with Point Beach on what their, on what one individual's thoughts are on what they will do when that comes available, that they're gonna talk to people about, do you or do you not want the sirens? But that's not on paper, so I can talk to you about that later, just so you know. But no, that's good to know. Some of the other ones I've talked to don't want anything to do with them either. But with that, I am encouraging people to sign up for our Rave Alert, as well as maybe download any apps to their phones for weather notifications.
Did you, Tracy, did you put anything in the flyer for tax bills?
So yes, I sent that out, I think 2 days ago, so I know I was kind of late in doing that. We'll see whether or not it gets put in any of the tax inserts. So,
I know they're working on them, I don't think they've even sent out yet.
okay, yeah, I know someone was working on it, so I actually had a local EM discussion the other day in which they asked me to put something together to hopefully be included in the taxes. So I sent that, you were CC'd on it, so all of the clerks got an email and all of their supervisors got a CC on it, so they at least know it went out. And we'll see where that goes. Hopefully we can get more residents to enroll in the Rave Alert for emergent notifications.
Okay.
So brief on COVID-19. So our office continues to do the mortuary survey report 3 times a week. Not that long ago on one of my state briefings, the mortuary survey team made a comment of a concern they have with the number of deaths. So they're predicting that will happen by the end of the year due to COVID. So that is, excuse me, some of the information that I do include in my mortuary survey. And the other thing we continue to do is the monthly PPE distribution for all the frontline responders.
Okay.
Any questions on what our office does with COVID-19? Yesterday, we held our monthly virtual EOC briefing. There was a few different offices or departments that were on there. UW Extension is holding their pesticide application virtually, and due to COVID-19, some sort of applications were extended through December of next year. Just pull that up real quick. Public information, we've got the new county website in which she puts all the county numbers on there that Cindy sends out daily. And they just recently started including the state numbers on the county website, as well as they are linking a lot of the orders and stuff like that that come from the state onto the county website. Law enforcement was on there. I'll let Matt talk about that. There's really not too much more. Red Cross continues to do virtual response. So just in regard to COVID-19, there was not a whole lot that was discussed yesterday. Our next one is scheduled for it in January.
Okay.
And then the next on the agenda is coroner input, and
That one, I'll take that one.
thank you.
And I asked Tracy to put that on the agenda, and she just slipped it into this spot, which worked out fine. But anyways, the reason I put that on there is that the coroner had contacted me last Thursday, I believe, just before Tracy sent the agenda out, and uh, he had made me aware that he was going to be requesting a funds transfer. Now, Doak, you're on finance, so on Monday when we met, we approved that transfer of funds for the coroner as well as for the sheriff's department. Um, and so just so you're aware that that funds transfer that the coroner had requested has been approved. It'll come up on the county board, you know, to finalize it. But that's what the coroner's input is about. Is there any questions on that?
So,
Pardon?
what was the transfer?
The transfer for him, it was a total of 14,995. However, he had some revenues that, because of the increased deaths that he had, those revenues decreased that amount. So the actual funds transfer would be 7880. Okay. Uh, and it was just strange because he bases his budget basically on previous year's deaths. According to him, COVID did not seem to be the driving factor. It's just that we have a number of people that are elderly and passed away. Uh, I have a hard time blaming COVID for someone who dies when they're 95 years old. You know. Uh, but anyways,
So what's the
that
income side of it?
the income side for him, every time that a person dies, there's a okay, he gets a permit for cremation, okay, which the cremation amount is 5,650. Death certificates, they charge for death certificate, you know, that's another 500-600 bucks. And then there's referral fees for donor tissues, okay. So he gets revenues that come in,
Right, okay.
just like a marriage license, you know, same thing. We get you coming one way and leaving the other way. So, okay. Any more questions? All right.
John, I should
Yes.
just mention a few other things. So with the COVID, just so you know, the testing sites that are spread throughout the state of Wisconsin with wing support are currently scheduled to go through the end of March at this point in time. And then just recently, our office received information for nursing homes and licensed facilities to contact our office if they have a staffing shortage due to
Mhm.
COVID-19. So we just recently got additional paperwork on that. And then, even though I don't have the final paperwork yet, with the signatures on it, we have been awarded monies for clean sweep for 2021.
Oh, okay, good. Wonderful. Have you heard anything as far as inoculations go? Of the vaccine or anything, or how that's gonna work?
Actually, tomorrow I'm on a phone call tomorrow in regards to that.
Okay,
So the only thing that our office has to do with that right now is when it comes time that Kewaunee County may be looking at doing clinics, we can request additional um, not vaccines, but Band-Aids, sharps containers, stuff like that for public health.
okay. All right. Any other questions for Tracy? No other questions? Matt, you're up.
All right, we'll start with our first one, which is the 2020 budgets. I got two documents here. This is the actual end of year, sort of the balance of the year, the records. So as was stated, much like with the coroner, this actually went in front of finance, I believe, Monday morning. But just want to give hopefully a heads up on what it kind of looks like as we wind down 2020, and then the budget transfer request going into 2021. We have it? Yeah. Okay. You can see that. Yep. So the first document with all the lines, that's what they call sort of the end of year budget estimates. So it basically provides us, and this is as of the end of October. So we have to use those numbers and kind of estimate out through November and December what's that actually going to look like at year's end. So we did all of our estimating, and then you have to basically balance those different budget line items out. So if you go to the second page at the bottom, you'll see in bold where it says must be zero. That's basically how all those budget line items sort of rectify each other. So a good example is our overtime on patrol is over, but some of that is supplemented by what revenue through like safety grants or a click it or ticket. So we would then, of course, take the monies from the click it or ticket, bring it over to that overtime because those two are relative to each other. So there's a lot of that goes on, similar to board of prisoners or food, because we're down in those. Well, therefore we we have that residual, but then on the other side we don't have the pay for stay, which would be a revenue source. So all those numbers with this year with COVID, they all kind of ebbed and flowed. So at the end we just have to make sure that we rectify those against each other. And that brings it to the second document, which is that actual budget transfer request. And so on this one, I mean, there's literally things that are down in the $1.50, $200, and Paul doesn't get too worried about those in his budget request. He's focused on some of the bigger ticket items. So if we look at that budget transfer request, again, you see highway safety. So highway safety is a grant that we got for like your click it or ticket and things of that nature. Well, that automatically reflects on overtime. So then you see over on the right column, it says wages overtime. So we use that 15,000 to offset the 40. So basically you're just taking various accounts that you were over on, going into those accounts that you're under, and making sure at the end of the year, it's all rectified and balanced out. I guess for the purpose of the budget, the 2020 budget, if we go back to that last form, you'll see on the second page, second column from the right, you'll see remaining. That's the remaining budget. So if you take that number all the way down to the bottom of the second page, second from the right, you'll see 154,836.65. That is our remaining budget. So when all is said and done, even though we have to move funds from one to the other to cover some of these shortfalls due to various items, in the end, we're that number to the good. So that's the amount of money that's going to end up going back into the general fund or wherever that county board is going to put it. So overall, that's a good thing. So with everything dealing with COVID, I mean, I hate to say that, budgetarily wise, it's had a lot of implications, but budgetarily, we came out of 2020 pretty darn good with everything that's going on. So, yes, we did have some COVID support money for a lot of the janitorial, the different supplies, PPE supplies. A lot of that was covered under the state money, which was great. But there's a lot of other things that we had to do and we did do that also kept those numbers down. And I think a big part of it is when you look at salaries overtime, that could have been a lot worse. But because of the management of the staff, looking at shifts, looking at maintaining that separation, that kept us down. I was at Badger State Sheriff yesterday morning down in Manitowoc, and some of these jails had to go through them like wildfire. And that can really destroy budget. So we were very fortunate, but again, that's not just luck, that's management. That's looking at how we can mitigate our risk. So, big thanks to the command staff and everything they do every day. So any questions on the 2020 budget and that budget transfer request? We'll go down to review of overtime and I turn it over to Chief Deputy Cornelius.
Thanks, Matt. Earlier I handed out a 3-page document. Again, it's the overtime review. We're coming into the final stages of 2020. And I handed out 19 and 18. And just to give you some comparisons again to look at, last year we're at 475 total hours of overtime for open shifts. This year we're at 485. As the sheriff indicated, COVID was a part of that, and we see that that's going to be a little bit higher than we projected, probably in the 600 mark by December 31st. But again, it's a lot better than what you can look at in 2018, where it's 820 hours. Again, with COVID out of our sites, I see that coming down to 300, maybe even less in the next year or so. So again, it's a schedule, and it's the sheriff indicated the command staff looking at scheduling, the lieutenants being creative, and the union and non-union employees working with us to keep those shifts when they become open, that they're willing to switch schedules to work with us. The other two items to point out is at the bottom, the saturation patrol, and you can see like in 19 we only had 12 hours, and I believe in 18 we had 0. We had 337 hours. That is all click it or ticket. And I just checked the numbers. We received 15,683 in revenue to offset those 337 hours. And the biggest one here that really stands out is the scheduling of overtime. And that comes from the jail because of the non-union employees. If they work over 40 hours, we have to pay them extra amounts of extra regular. If you look at 2018, we're at 750 hours. In 2019, 272, and to date we're at 104. And that really does salute Lieutenant Van Orn for his creativity in the jail, working with those schedules and bringing that number and driving it completely down to peanuts compared to where it was in 2018. But overall, the overtime, it looks tremendous compared to where we were several years ago.
Doing a nice job, Dave.
Well, all these guys are. I mean, it's just amazing.
I mean, you guys, you got to pat yourself on the back because I can remember some of these reports were really horrible.
Yeah, I remember one officer having 485 hours just himself in overtime. So I mean, that's all. That's done with. So tremendous job.
Good job. Okay. Next.
The update on the facility. So we had our meeting last night, and I know for Joe and Scott, here's basically what was provided last night. You want to share that with Scott when you're done looking at it? So basically, since our meeting in the spring, we had quite a gap because of a lot of things, but we didn't stop working on it. So one of the big movements on it was that request to look at that $35 million phase 7 option or option 7 and how we can phase that down. And so then there was a request made to John Kane. He went back to his estimators and broke that project down. And so basically, the long and short of it, last night, the recommendation from the group was to move it forward in a form of a recommendation to the county board in regards to option 7, the revised option 7, which is just the jail specific part of that project. So that's where it was at. There's a lot of discussion. Anybody else that was there can kind of pipe in, but there's a lot of discussion in regards to timelines, referendums, what should and what shouldn't be done. But in the end, we all felt that in order to be able to do the things that need to be done, such as community outreach, such as providing more solid numbers, a lot of these things we can't do in phase 2. And so we realized that in order to do a lot of these things to move this, we've got to embark on phase 3. And that was the recommendation at the end of the night, was to move this forward to the county board. So that will happen at their January meeting. It'll be before the county board, recommendation from that committee to move forward into phase 3. So again, that's sort of the long and short of it, but I don't know if anybody else wants to add anything that was there. So I mean, we're on a track. At least we're kind of back on a trajectory. We're moving this forward, albeit very slowly. When we talk about timelines, really in a referendum, we're probably looking at fall of 2022. There's really no opportunity to get this on a referendum before then. Jeff Wasnicki is going to look at it along with Administrator Feld. But chances are we're probably going to have this on a referendum in the fall of 2022, which is fine. That gives us a lot of great opportunity and time for community outreach, education, and getting the community behind this. So I don't think that we really want to try to fastball this and end up tripping over ourselves. I think that this can be looked at as an opportunity to really solidify this thing so that when it does go for referendum, we've got solid support and we can move this forward.
Any questions for Matt?
So this, what kind of, did you have some kind of cost estimate?
Yes, so I mean they're basically in very rough numbers looking at around that 19 to 20 million dollars. So we brought it from that 34, 35 down into that 20 million dollar number. The important part here to remember, I guess, as far as looking long term, we're doing the absolute necessary, right? This is bottom bare bones, stripped down what we feel is an absolute need versus any sort of wants. But we got to keep our eye on the ball that courthouse, when it was remodeled a decade ago, that was a band-aid at best. And I mean, if you take a walk down there by our offices, I mean, we've got water seeping in from the foundation. The roof has got issues. I mean, that was a band-aid a decade ago. So we do have to keep our eye on the long game. That in a few years, even after we get this first phase of this project done, we've got to realize that this is sort of never ending, right? It's an evolution. So we can't just pat ourselves on the back when this is done and say, there, let's not talk about it for another 30 years. We have to realize that pretty much the minute that lawn starts growing, we got to start talking about the sheriff's admin offices as well as that courts. So that's something that we got to just keep in front of everybody at the county board, because I think there's always a natural a tendency to walk away from it, right? To say, there, we did what we did. Now let's not talk about it ever again. And the way we're approaching this, because we scaled it back, we're not going to be afforded that sort of, spiking the ball at the touchdown, right? This is just sort of the 50-yard line. All right. And then we've got to march it down the field even further, because this project in its totality isn't going to be done after this part of it. So just something that I think we got to keep in front of that county board.
It's going to be a tough sell.
But I think, as we said last night, I think we can be proud of how we scaled this. I mean, I don't think any of us should be embarrassed to look at the frugality. I mean, the way that we really wound this tight as we could. I think we can be proud of the product and the vision that we're putting forward. The big thing is, let's not lose sight of the long term. This isn't over, and so we're doing it more in palatable chunks versus one big swallow. We're saying, all right, let's bite this thing off in pieces. And that I think is going to be easier for the community to process versus this one big $35 million chunk all at once. So I have no problem going to the community saying we did a hell of a lot of work. We screened this thing back, we refined it, and what we're putting in front of you is the absolute bare bones minimum.
I think one of the items that was important to remember is that every year that we delay from here on out, every year, the price increase is about 4%. Which is look at what we had 20 years ago. We could have built a courthouse and a jail for $20 million. Now we're just building. We could have built a jail and a sheriff's offices for $35 million. Okay, not including a courthouse.
Yeah, I think sometimes, we've got to always remind ourselves in government, our job is not to not spend money, right? Sometimes people think that our job is to completely tighten down the cinch and not spend anything. And that's just as negligent as the other opposite extreme. Our job is to be good stewards of the money. And by sitting on our hands and allowing those costs of construction to just keep creeping up on us, that's not good stewardship of money. We're not doing our job.
No.
So like you said, John, this is going to be a battle, right, to move forward. But I think we can be confident that we're being the best stewards of the money that we can.
Pushing it off to somebody else.
We got it pushed off to us. It's going to be a tough sell, but hopefully everyone will be on board. Need to ask a lot of questions and keep an open mind. Okay. Next.
I'll touch on staffing, and I'll let both Dave and Jason kind of add to it. So we're in a good place with staffing. Of course, everybody's aware, or if you're not, Lieutenant Jason Bayers has been promoted to Chief Deputy. So upon Chief Deputy Cornelius's retirement in January, Lieutenant Bazier will be assuming the reins as Chief Deputy. So that's a great move forward. So it's definitely a changing of the guard. There'll be a lot of newness going on over there. And then subsequently, we did post for the operations lieutenant position. We had 3 applicants. We'll be doing those interviews. I've requested the 16th to the 17th. I haven't heard back, but we're going to try to get those interviews out of the way before the holidays, and hopefully solidify that appointment or that position as well before the holidays. That's the goal. That'll then trickle down to other vacancies, but those subsequent ones are going to be much easier to fill. It's really this next one here of the operations lieutenant, and then maybe that next one. Those are very critical. And then after that, it's just a matter of falling into patrol and the new position into the jail dispatch. So those become a little bit easier. But that's where we stand as far as that cascade. We did do an eligibility list posting. We had initially, I think we tested for 9. I believe we are going to be interviewing 7. 8. Okay, so we had a few. One didn't show up, and another one didn't pass. So we always get that. So again, not a great amount of quantity, but pretty good quality. A lot of these folks are coming from other agencies. A lot are coming with us or to us with previous experience. So we always say that what we lack in quantity, we're fortunate to make up for in quality. We got some very good candidates. So we're going to be trying to do those interviews as well before the holidays to try to, keep that rolling, so that when all this movement happens in January, we've got everything in place. Because as Chief Deputy talked about the overtime, some of that over the years was created because of these massive gaps in the hiring process, that we'd have these holes in our shifts for 6 months at a minimum, because the process took so long. So we're very appreciative this idea of being able to do eligibility lists that allows us to lean forward, get these folks in position that when there's a vacancy, we can just pluck them from the eligibility list and go. This idea of every time there's a vacancy starting this process over, it's killing us in timeline. So that's one of the reasons that I think we're able to streamline that overtime as well, is when we have a vacancy, boom, grab someone from eligibility and get them in there. So that's been a huge help to us. So again, we're moving forward with all those. And again, if David, Jason, you want to add anything in regards to staffing?
Yeah, just to follow up with the testing, that's for 2 openings. Those 9 people or 8 people that we'll interview is for 2 openings. And again, remember our history here. We hired 2 last time. One completely made it through the FTO and decided the job wasn't right now for him, so he bailed out. So that position's open. So when we hire 2, the possibility of losing one during the process and having that eligibility list is huge. So again, we got to remember that as soon as we exhaust these 7 or 8 people, we got to start looking at recruiting some more and getting them on board. Just a couple of things to follow up with staffing. We'll have Chelsea Broomhall. She'll be starting Recruit Academy January 6th, 2021. And she'll be a certified officer when she walks out of that program, which is huge. We want to invest in her. She's an excellent officer, and down the road, we'll probably invest in another one of the jailers for the same position. We recently hired a new cook. She started with us a week and a half ago. We still have one person out on FMLA, and that'll still be through the early parts of 2021. But that's all we have for staffing. And as for the for the E section of the agenda for updating on COVID, I'd like to turn that over to Lieutenant Vaser, if that's okay with you, Sheriff.
Yep.
He's got an update on COVID and some of the things that we're going through with the scheduling.
Sure. Just to reiterate one point on staffing, we're 1 down, we're soon to be 2 down, and that is getting critical numbers again already. We've seen in the past when we go 3 or 4 down that it puts a lot of stress on our jailer dispatchers, and we tend to lose people then because of all the stress on them, because they're constantly forced into extra shifts and stuff. So it really is important that hopefully we get 2 people that do really good and stay on the job so we don't end up with that critical numbers. The other thing we always have going on is we have new employees, so we got to send them to jail school. So you're 2 down, but right away 2 more people go to jail school, or like Chelsea is going to the Recruit Academy. It puts you further down, so it just puts more stress on those individuals that are working. So that's why it's very critical we get those people. So what we're doing with COVID, we've touched on a lot of this in the past of how we have contingency plans. Recently, we had a couple patrol officers go down and we were able to move somebody from the jail onto patrol, our cross-trained officer, so that pretty much eliminated most of the overtime, if not all of it. Um, our administrative assistants, one of the worries there is we don't have much of a contingency plan for them, so we have them on a COVID schedule where only one is in the office at the time and the other one's working from home. Hopefully, they wouldn't both get COVID at the same time. And the problem that would be there is if they were both out on leave at the same time, um, officers could probably type their own reports up and, they wouldn't be as efficient as they are now, but there's a lot of paperwork that the administrative assistants do that the officers aren't even aware of. OWIs, for example, they have 5 days when somebody's arrested for OWI. That paperwork has to be to the state. A lot of officers, they probably have in the back of their mind, they know they got to get that paperwork in right away, but they don't know how to get it to the state. They don't know where to send it. So it really would hurt us if we lost our administrative assistants at the same time. So it's important that we try to keep those folks healthy. We did get that Skytron device, which is that big light bulb that you put into a room and it sterilizes everything. They've been using it. I talked with Lieutenant Van Aram about it. He thinks it's working fine. He said it gives off kind of a sort of a burnt smell is the best way he could describe it in the room after you run it, that it smells kind of hot or something in the room. So we think it's working. Um, we also got a few ozone generators that we plan on using. It's just another device that you can sterilize a room. It uses ozone, which well, I'm not a scientist, but it's molecules that want to bond to atoms, and it bonds to viruses and bacteria and stuff and ends up killing it. Um, those were pretty cheap and they came under the grant that the sheriff had applied for. And we plan on using those, one in the jail, one in the courthouse, and officers will be able to take one to their squad car and bring it home and they can run it in the squad car for like an hour and it should sterilize everything inside the squad car. So just another good device for trying to protect our folks as much as we can. Along with that grant, there's also a fit testing device for wearing our masks to make sure they're working, and that's on back order, but there's been a lot of communication that the sheriff has had by email that I know it's going to be coming soon. Overall, we had about 10 employees who have been off for different periods of time for COVID. So our overtime, keeping it in check, is really a good testament to show that even though we've had 10 people off for many of them extended periods, we've still been able to maneuver folks around and keep overtime to a minimum. Now, if we ever had a big, 5 people go down at once, that would drastically change that. We'd have to incur overtime and probably use other agencies to help us out. And we're not out of the woods there because once people get it, they're immune to it for a period of time. But we haven't had enough people that got it yet that we don't have to worry about staff shortages. I know some other counties, although they lived through the mess of, like, I think Door County was down to 2 dispatchers at one time. Once they made it through that, now they're pretty set probably for the whole winter. We haven't had any of those critical staff shortages yet, and hopefully we won't. And hopefully guys and gals are being cautious and doing everything they can to prevent the transmission of it, and that'll help us from having those types of problems. As far as protective equipment, we're doing pretty good. When we need stuff, we're usually able to find it. You can pretty much order anything now online, masks and gloves. You pay more for it, but like ridiculously more than you paid a couple years ago, but at least we're able to obtain it. I did talk with a glove distributor, just so people are aware. There's supposedly a big scare in the largest rubber glove manufacturing company, and he thinks there's going to be a shortage coming up again. So just something to think about. That's all I have.
Kind of like a toilet paper scare.
Yeah. It's back out.
Just to add, I was kind of interesting. I ran this week's article, just sort of doing a end of year update for people in regards to dispatch. So I was running a lot of the calls, and I was stunned that you would think this year our rescue calls would have been through the roof with all this, but actually they're down. So as of yesterday morning to date, we were at 1,036 versus 1,108 a year ago at this time. So it's interesting some of the things I think people would assume are going through the roof, that we really have managed to stabilize things here throughout the county. One number that we're in, it's kind of hard to break down because it comes to us in different forms, but this idea of EM1 suicides, that will be an interesting number at the end of the year to see where we are, because we've discussed this internally. We have seen definitely an increase in regards to mental health issues. So whether those manifest through an actual EM1, whether those manifest through an actual attempted or committed suicide, those manifest themselves in a lot of ways. But it'll be interesting to look at it, sort of universally at the end of the year to say, okay, what did we see in regards to mental health here in Kewaunee County? We're having a meeting right after this meeting with Human Services as well to talk about some of the crisis services and how we interact. But that continues to be a real strain. And I definitely would say that in 2020, we've seen that tick up in regards to the mental health side of things.
Okay. Um, One question for you, Matt. When I know we talked about it before, but when will you see the new equipment for 911 in the install?
Oh, in regards to that, so they are got us on a schedule to get us equipped. There's a lot of the background stuff that's going on currently. We've got to work out what's called the Annie and the Alley lines. This is this whole idea with Steve Hansen and GSI about making sure that we've got all of our data is solid, right? So one of the examples of that is over the years it's gotten kind of convoluted where that fire number, where does that actually be marked on a map? What are the different Latin longs? That all has to get worked out ahead of time. Good examples, we got a call. Steve Hansen was talking with Brown County, and when you go up into our northwest corner of the county, Door County, Kewaunee County, and Brown County all converge basically in Dykesville. And so when you get into the bay, these are the kind of things that have to be worked out, is even those kind of things of on a map in the middle of the bay, who's got what, because that's going to dictate where that call goes. And historically, we have not had any jurisdiction in the bay. But if you were to look at it and actually draw lines on a straight rule, we have a little section of the bay in there, and we said that's a waste of time to try to carve that off for Kewaunee County. We said so really anything off the beach along that bay is either Dora County or Brown County. In our jurisdiction, our response is going to end at the shoreline. But those are those things that even to this day, all these years later, they're still trying to pinpoint and say, okay, where do the lines fall? So there's a lot of work that's going on with that. But regardless of all that, first quarter of 2021, when all that equipment's going to start to roll in, get set up, the training. That's all going to start to work its way through in the first quarter of 2021. But there's been, I mean, Lieutenant Van Aaron's been busy. He's got reports he's got to submit back to DOJ, for the grant and its requirements. And he's always on the phone with one vendor or another, making sure that all these things are being sequenced properly. So the work continues, but the actual equipment rolling in, installation, training, and implementation, first quarter 2021.
Now, do those lines also extend out into Lake Michigan?
Correct. So when you look at jurisdictional boundaries, I mean, the actual county, ours goes midpoint Lake Michigan. So when you look at jurisdiction, the city of Kewaunee, city of Oklahoma, they go to the end of the pier. That's basically, so they've got the harbor, if you want to call it that. But when you look at jurisdiction for, let's say, if there was a crime committed, ours goes out to midsection Lake Michigan. So that again, are just things that we have to make sure we're covering. Because when you look at what a kind of, I wouldn't say it's a debacle, but you look at it right now, I mean, when you dial 911, and if you're anywhere along the fringes, you're bouncing back and forth. We're always doing transfer of calls. Okay, this is a Brown County call. We're going to transfer you. Or we end up having to, do the page, whatever it might be. So getting that all worked out in this new environment where people aren't getting jockeyed around from one jurisdiction to another, that's important. And then you look at what Brown County, what happened with them, was that last year, and some of you may have seen this, where they brought a new system, and on their mapping, they were showing, some of their units in another country. I mean, it was absolutely insane, and they ended up having to scrap it, rebuild another one. So we want to make sure we get this right the first time, that when we do incorporate or implement this, that we're ready to roll and not having to shut it back down, go back. We want to make sure it's done right the first time.
Okay, good. Um, and again, a question for you is supposed we have a vaccine coming. Are you guys planning for it?
So the vaccine, actually, yesterday I was at that conference, heard from Dr. Rai from Prevea, who did a wonderful job of answering a lot of questions about what it is, what it isn't. And yeah, they're looking at within the next, really within, by the end of this year, it's going to start to get to some of those distribution. You talked about the spoken hub, getting to those distribution centers and how that's all going to look. But they did talk about getting those out primarily, of course, first year nursing homes into your volatile populations. And then probably in the first month or two of the new year, starting to get those essential workers, first responders. And one thing he did say is be aware that this vaccine, much different than a flu vaccine, there is going to be some very limited side effects where there's your officers or whoever are going to feel a little cruddy. So don't line them all up in one day because it could have, like Lieutenant Vaser said, ramifications on the staffing levels. So we've got to coordinate that when the time does come. And he said also those that have had it. So let's say between now and then, if we do have staff that have it, they do have that immunity for those 90 days. So he said, coordinate that as well, but you still do want to get that vaccine, even if you've had it. So the fact that you've had it, don't think that gives you the golden ticket. It doesn't. You still want to get vaccinated. So it was interesting to hear it from him as far as timelines, but I think you're going to start to really see this unfold very quickly. And we just have to make sure that those processes are in place, that it can be done in an organized fashion and people aren't getting any anxiety over it. That's going to be the big thing. But yeah, I mean, I think it's exciting that he's saying by mid part next year, to really have a good handle on this. I think that's optimistic, and I think that gives us some sort of a sunset, something to look forward to say, okay, that's when we can start to really look at some silver linings.
I was just gonna say, when I think first line, I'm thinking nurses and doctors, but are we talking all fire, sheriff? All those are in the first line,
No, medical is always going to be first line. Nursing homes, medical staff.
Oh,
We
so-
consider it essential. We'd be sort of that second tier.
oh, okay.
Yeah. No, they're
Even
going
though
to
you
get
guys are responding, and being exposed to it, really.
Some of the initial vaccines that are coming out, there's about 49,000 that are coming in the first batch, with about 16,000 coming after that. And that is supposed to be for the medical field, and then after that would be the nursing homes.
And then we go to the responders? I mean,
I haven't.
That's a great debate right now that we're going through. So
We're going to be
it's
second.
interesting.
tier.
I would have thought that
they're trying to put
you would have been in the
they're
first.
trying to put law enforcement into that, but right now there's much debate about it.
Okay.
Yeah, we'll probably end up in that second tier. And again, when you look at the constant exposure, what you see in the medical fields and nursing homes, yeah, we have the potential for it, but we also have the ability to mitigate. We have the ability to say, let's say that rescue call, unless we're absolutely needed, law enforcement, may not respond to that one unless we're absolutely needed for some sort of lift assist or something. And rescue again has the ability to go in with PP, but when you're talking about nursing home, that's every day. The medical field is just that more. I think, and Tracy, you know more than I do, but this idea of constant exposure, and so we've got to take care of those folks first and foremost.
And those vaccines that they talked about that are originally coming out, that was the preliminary numbers, and every so many days they're updating that information.
So one thing that the doctor did say, and we asked that he work with us, and he's going to put together an actual letter, because one of the big things is all the anxiety that people say, no, I'm not going to get that. That's a bunch of hoo-ha and everything. And, having him put together a very easy to read, sort of broken down to the civilian side, what does this vaccine look like? What is it and what isn't it? And what does that look like? And so the Badger State Sheriffs are actually going to work with him and then put this out to the community saying, don't be afraid of it. This is what it is and what it isn't. So we're very grateful that he's willing to kind of, I don't want to say barney it down, but really break it down for the layperson to be a little bit more comfortable that when this happens, we don't have all of this resistance and anxiety. We want to prepare our communities to say, okay, this is the next step. This is what needs to be done.
Are the officers, is it going to be mandatory they all take it, or is it optional?
That would be a good question, and I'd say that's more of an HR thing. I don't, I mean, you look at some things like my wife's in the nursing field, and that's definitely going to be mandatory. I think of myself in the military. I have no doubt they're going to line us up and we're all getting, that there are certain, but as county employees, I think that's more of an HR thing as to where's the boundary, what can they mandatory and what can they not mandatory. So that might be a good Scott Feld question.
I don't know.
Along with public health.
Right. And yeah, Cindy's going to be a big part of that. Yeah.
a lot of medical fields, you know, what they do is you have a choice. It's you either get it or you wear a mask all the time.
Right, I know in the past,
And-
if you had, didn't take the flu shot, you gotta wear a mask all winter, in the hospital or whatever.
So it's sort of putting pressure on people to take it.
Yeah, these are all good conversations, I think, that need to happen in the next, let's say, 3 to 4 weeks, you know, as this is unfolding versus waiting till it's sitting on the shelves at public health or at a clinic and saying, all right, everybody go get it. And now we got to deal with all the questions. I think it'd be wise for us to get ahead of it and answer a lot of these questions.
There's nothing in the county language now that says, as far as you must take
Mhm.
vaccinations.
The only thing we had similar to that was when we get tested for TB, and that went to the side of the road. That used to be mandated, and now we don't force anyone to have that done. We don't even make it a policy anymore.
The fire department's option is there.
Okay. Any more questions?
I have one more.
Go for it.
I don't know if you, maybe I missed it, inmate census report.
Oh, yep. So that is right here, and I can pass it around. We're at 23.5. So, and then here is the actual breakdown of those individuals, whether they be on home monitor, out of county, or in our current facility. We're starting to see, we just had a conversation with Lieutenant Van Aram yesterday, where you're starting to see those numbers kind of slowly work their way back to pre-COVID. I mean, when we were having these conversations, let's say a year ago, we were always bumping around the high 30s, low 40s. That was our daily population. And then, of course, we took a lot of precautions to get everybody out of the facility as much as we could, whether that be electronic monitoring, deferments, whatever it might be. So we're starting to see again, and also the courts. I mean, the courts were pretty much out of commission for a good duration of this year. And so now Judge Main is slowly turning the courts back on. So you're going to start to see sentences. You're going to start to see these kind of things. So our numbers are going to slowly start to creep back up again, but we've got to be careful because we still have the same limitations. We can't just bring everybody in because aside from what always were our limitations with classifications and the like, now we've got to be aware that there's that potential for cross exposure. So just yesterday, we transported 2 out to other facilities, more so as a precaution in regards to possible exposure because we just don't have the ability to, you know, to isolate with our limited facility.
Matt, I have a quick question with your Badger Sheriff. Did they mention anything yesterday? Let's say we get the vaccination. Will there be an official card indicating that you received this? Because an inmate comes in, we go, have you been vaccinated? Because this will never stop us from wearing these. As soon as we bring somebody in, think about that. How do we know? I'm sure it's going to be a question. Have you been vaccinated? Yeah. Well, where's your card? Nah, I don't have a card. Again, there's got to be a check and balance here. You're just shooting people in the arm with this. There's got to be something. Yeah, I've been vaccinated. So that's gonna be interesting for our staff because
And they
never gonna
didn't-
get rid of these.
Yeah, they didn't bring it up, and that's what I asked the doctor. Actually, said, okay, because we talk a lot about, you hear a lot about efficacy, you know. So even with that vaccine, you know, are we at some point in time able to just completely abandon these and go back to normal? And they're like, well, you know, got this efficacy where it's not really 100%, but if we can get, he basically said, if we can continue to mask and distance going into the new year, get, I think it was like 75% of the population vaccinated. They feel between those two, we can. He used the word eradicate. We can eradicate this thing. But yeah, I mean, back to the thing with what was your history. I mean, we all have it now, right? I mean, like when the kids go to school, you have to be able to show it. But typically on a daily basis, and we don't carry that around with their driver's license. You know, here's your driver's license, here's my vaccination.
Yeah, I don't know.
You know, yeah, that might be what they'll have to do is put it on, become part of your driver's license.
But think about it. We'll never get rid of these in the jail because our inmate, a new arrest comes in, and you go,
You have
"Sir,
no clue.
you have no
Yeah.
clue." So if he's exposed, you're gonna get exposed to it.
Mhm.
Again, it's just weird thinking,
Right.
but it's just
What-
what's gonna happen.
And I think a lot of it's going to be immunity. If that vaccine, let's say they talk about an initial shot and a booster shot, if that then creates, if that does actually create immunity, well, then it's no different than what we've been doing for decades with anything else, the flu, you know, anything else. It's that issue of efficacy, and I haven't seen anybody come out solid and say, yes, you know, once you get it, you're solid forever. I mean, it's like a flu shot. You know, he said yesterday, every year they basically throw a dart at the wall and say there's 10 different strands of virus. We look and say, let's do the flu shot for that one, and they hope for the best. So, I mean, we've been dealing with sort of a crapshoot all of our lives, but never really paid attention to it. This has just brought it to this heightened sense of alert that, well, we've got to have, everything's got to be 100%. I don't know that anything's ever 100%. Never has been, never will be.
But we'll take that 98.
Sure.
I mean, it's, you look at,
Right, that's what I mean. You have the initial and then the second, yeah.
3 weeks later, I believe they said.
you know, they did that with hepatitis. If you remember hepatitis, I don't know, you guys had to get it, but you know, that was something that we had to get. And that was a series of like 3 shots or something like that, so far apart. And
Lot to learn yet. You know, it's nice to see that we're starting to turn the corner, I think, but there's so much left unanswered.
okay. Anything else?
John,
Scott?
do we have to formally approve the end of the year budget transfer requests as a committee?
Well, the transfer request went through finance already. Okay.
I just see a line where oversight committee approved, denied on one of the lines. You know, we used to do it, so.
Yeah, I'll tell you what, if you wanna do it as a formal request for the committee, fine. Um, because of the timing between finance and and this meeting,
It's done.
it's been done. But if you if the committee feels that you want to do it, we can do it.
Because it will be on the agenda for county board. The resolution's been drafted. So I guess, yeah, you could have both the committee, finance, and this committee having approved it.
Yeah.
It will be on for the resolution next Tuesday.
It's a technicality, but it's fine. We can do it.
I motion
wanna-
to approve the transfer of budget requests there.
Okay. And motion by Scott and seconded by Doak. Any comments, questions? Hearing none. Those in favor signify by saying aye.
Aye.
Opposed? That motion carried. Yeah, quick and simple. All right. The next scheduled meeting is January 13th. Here again, 8:15. And the proposed meeting for February would be February 10th. Again at 8:15 here. Any comments? February, you won't be here with us, Dave.
January I might be, so. January I'll be here.
We'll get the final word from you in
There you go.
January.
I'll do my final blessing.
There you go. As far as comments from the chairperson, thank you very much to Tracy for getting us out of a bind. Nice job. Matt, Jason, Dave, thank you very much. You guys do a fantastic job with all your people. Appreciate it. Please pass it on. And to the rest of you guys, thank you. Appreciate it. You can take us off the air pretty quick here. I need a motion to adjourn.
Make a motion to adjourn?
I'll second
Okay,
it.
motion by Doak, second by Scott. All in favor?